World Optometric Day 2021. This webinar has been organized by the Department of Optometry, Tripura Institute of Paramedical Sciences, to commemorate the World Optometry Day 21. I especially welcome Professor Biswajit Mondal, Director of Class
and unprecedented pressure, putting their physical, mental, and social well-being at risk. Exposure to excessive stress for prolonged periods can have many harmful consequences on the emotional and mental well-being of frontline workers. Now, without delay, I would like to leave the platform in favor of our eminent speaker to continue our live session. Now, sir, the stage is yours.
Is my slides are visible?
Yes, sir.
Yes, sir.
Great. Thank you very much. Yeah. Before I start talking on my topic, uh, let me thank Dr. Devashish Mondal for his kind invitation to and offering me this wonderful platform. And I'd also like to thank Principal Madam uh, of this TIPS, Tripura Institute of Paramedical Science. And this is really wonderful that I'm sharing your platform. And as I have seen for last many years that you all, this team Optometry tips celebrates World Optometry Week rather than the World Optometry Day. Probably we all celebrate it like just a World Optometry Day, but I have seen Tripura, the tips always celebrate World Optometry Week. So this is really a wonderful initiative to create awareness about optometry in our community. As you all know that many among us or many amongst people, those who are not aware about our profession, even though they might have visited us, but even after leaving us, they do not know they visited an optometrist. Yeah, the topic which was given to me is effects of COVID situation in optometry practice. Then I found this is really very relevant, and at this moment, this is the topic which we all are talking. Yeah, we remained all so enthusiastic about the year of vision, as all optometrists know that this Vision 2020 was a mission. And then suddenly the whole thing changed. The outbreak of the coronavirus disease was first reported in Wuhan, China, in December 2019, and it has since spread rapidly across China, the Middle East, Europe, North America, and the other parts of the world. COVID-19 was declared a public health emergency of an international concern on January 30, 2020, and is now a pandemic. With COVID-19 sending the world into lockdown, the main objective for many is simply survival. Thus, in spite of high hopes for the year of optometry, 2020 has quickly become the most challenging time the profession has ever faced. Hopefully, the COVID-19 curve will flatten with social distancing and several potential treatments are in the works. Optometry practices will survive this period and be stronger because of it, but there is no denying the challenges. COVID-19 is not an extinction event for optometry, but that doesn't diminish its stressful and humbling effects. The post COVID-19 landscape is bound to change many facets of eye care, including consumer behavior, business strategy, and practice operation. What follows is a view into each of these windows of what may lie ahead. And what's next? See, even before whatever challenges we face in our life, um, initially it takes time to accept. But for that, we understand that we do not have any other choices except accepting the fact. Yes, we have to accept, we need to adapt, and then we have to fight for overcoming. So the effort of re-engaging with patients while maintaining healthy margins is reshaping the optometry practice. And here, optometry practice in new normal, there are many guidelines has been given by different associations, different professional bodies, organizations. Here are COVID-19 guidelines for optometry and optical service. post-lockdown. By different organizations. As for optical space post-lockdown has been given guideline to sanitize and disinfect the workplace, guidelines for optical store, guidelines for optometry clinics, guidelines, contact lens guidelines, pediatric optometry and binocular vision, vision therapy guidelines, binocular vision and vision therapy clinic guideline, low vision practice guidelines. So there are many guidelines has been given by different authority so that we can practice safely. Yes, earlier for maybe few amongst you or the students listening this talk, still if you just a year before we used to talk about, do you know what is the method, what are the methods performing retinoscopy, what all are the methods performing ophthalmoscopy, do you know how to do this slit lamp microscopy, or have you ever performed keratometry? So there was a time when we used to talk about like methods of this operating system, how to operate the equipments. But now the we again, even the senior practitioners, those who are very familiar with the operating procedures and everything, they are very like they don't even need to think even the, about the operating procedures. They spontaneously their eye, hands, and everything is very coordinated, and so just they start practicing, and then it's all become very spontaneous things for them. But yes, today we need to add few more steps to ensure health and the safety margin. So here are the guidelines for optometry clinics. That is this piece for optometrists is mask, face shield, safety goggles and gloves, and disinfectant that can be used, soap, water, the sodium hypochlorite, and then hand sanitizer, surgical stick. So these all has to be added in our day-to-day practice for preventing infection. Suppose one patient has visited to your clinic. So earlier it was like one patient went, and even before they gone out of your office, somebody else could have been come. But now one patient, after he moving out of your office, or your staff need to clean every all equipments need to be sanitized, and then the other patients may visit. Patient examination. Minimizing a comprehensive eye examination time, maybe 20 minutes. It is again a guideline given by, I've seen in a paper, publications published by this some eminent professionals, that and it facilitates ventilation of examination room. If the room is air conditioned, clean and disinfect the filter at regular interval. Wash and of course with soap. Ophthalmic instruments need to be disinfected after every use, like forehead test, chin rest, knobs, etc. Any equipment, touching patients need to be sanitized or need to be disinfected. And the contact lens guidelines are, there is enough evidence to suggest that contact lenses are safe to wear during COVID-19 times. The contact lens clinic essentially should function as before with reinforcement of the care and maintenance instruction. hand washing with soap and water as contact lens hygiene, including the work surface disinfection, were always a part of safe practices in handling contact lenses. And contact lens care and maintenance in the clinic, the solution bottle should be wiped clean with the sanitizer when handling by any patient. Solution should be discarded every morning and a fresh solution to be used every night. Contact lens case most often is the weakest link when it comes to safety chain of contact lenses. All contact lens accessories, suction cup and the holders, plungers, etc. need to be cleaned with a soap and water and replaced periodically, and if possible, their use may be avoided. Pediatric optometry and binocular vision or vision therapy guidelines, apart from physical distancing, hand hygiene, administration of the COVID-19 symptoms checklist and disclaimer, use of personal protective equipments, including compulsory masks for the children, and attendant is to be ensured. Vision and vision therapy guidelines. Yes, here history taking, although history taking is an important component of binocular vision or orthotic clinic workup, it is important to reduce the time taken for the self. And the history can be recorded over phone, or the symptom survey can be emailed if the patient have prior appointments and email access. Vision therapy. In our regular optometry clinics where infrastructure support is not available to maintain physical distancing during in-office vision therapy, software-based home therapy should be prescribed. In general, software-based home vision therapy options can be explored towards providing television therapy consultation and management. Low vision practice guideline, as you know that in low vision evaluation, it takes a huge time to interact with the patients and to finally identify when a patient's presence in the clinic, only those clinical tests that are must, for example, high contrast distance visual acuity, binocular near visual acuity should be performed. And low vision practice guidelines, instructional videos for it makes a rehabilitation training or the use of a device. It takes many minutes to make them understood, to make them accustomed with the new equipment and new devices. But here we can do that. Instructional videos, writing instructions, and follow up using teleconsultation may help to minimize the duration of training. Teleconsultation can be considered in those patients where the vision is stable. Clinical low vision examination was done within 1 year, and the patient doesn't report any new functional limitations. So we may go with that. And the conclusions are, even before we conclude, even it is the professionals has faced many challenges during COVID-19. Or still we are facing that all challenges. Even we have learned many things during this period of time, and before even we have seen that during lockdown also, maybe there are some of the practitioners who has worked standing in front line, and those are practitioners. So here the optometrists, being primary healthcare professionals, are at high risk of infection and source of transmission of the disease. This guideline provides a ready reference for optical store, even an optometry practices as preferred practice guideline in COVID-19 or pandemic situation. How long this new protocol will be needed? Until there is a lower rate of transmission or a vaccine become widely available, they seem prudent for the near term. Back to practice won't mean back to normal. And even for detailed guideline, you can refer these all pages I have checked. So you also can visit where you'll be getting detailed guideline for individual specialty practices. And one among is this Turakia is Shaoji and Mr. Goel and et al. Their guideline is COVID-19 guideline for optometry and optical service post-lockdown. It is published in Indian Journal of Ophthalmology, which is a wonderful piece of publications you will get, where you'll be getting all details about the do's and don'ts during your practice at this new normal situation. Thank you.
Thank you so much, sir, for your inspiration and valuable words. And we
Thank
all
you.
try to maintain all the guidelines. Thank you, sir. Yes, in
Thank you,
this
ma'am.
COVID situation, from the very beginning, every frontline workers and as well as optometrists also has endured a lot of hardship and they are fighting continuously still. I sincerely hope that the world recovers soon from this malady that has claimed so many lives. And on behalf of TIPS, we salute all frontline workers from the heart. Now we are near to end of this program, and I would request respected Dr. Devahish Mondal sir to conclude our session. Sir, please proceed.
Thank you. Thank you, everyone. Good evening. Good evening, everyone.
Good evening, sir.
Yeah. Uh,
Good evening, sir.
yeah. Uh,
Good evening, sir.
Definitely good evening. I would like to thank Mr. Biswajit Mondal. How Biswajit Mondal explained how every optometrist suffered due to COVID situation. Really, not only practitioners, all the patient also suffered. I don't know how many days till we will suffer. Hope we will recover all the things soon. Thank you, Biswajit Mondal. You have highlighted the drastic changes of our practice in this COVID situation and all the solutions that can be implemented in our optometric practice. Thank you. Thank you, Biswajit Mondal. I also want to thank our principal madam for taking effort to make this webinar a grand success and contacting and promoting with other colleges and universities for participation. I would also like to thank all the faculties of our college for encouraging students to participate and also guiding us how we can make this webinar a grand success during this examination period. Yes, thank you again. This event would have been successful without the team's management as well as all staff and all the technical persons who helped us to make this webinar a grand success. The students and all viewers of this webinar, thank you so much for paying your valuable attention and also suggesting with our opinion. It's my pleasure to have been asked to propose a vote of thanks on this occasion. Thank you so much. Thank you.
Thank you so much, sir. And thank you all for joining us at our session. Thanks a lot. Namaskar.
My dear students, If you have any kind of questions, you can ask our honorable guest, Biswajit sir. He is left. Okay. So no one is here now, only students. When he left.
Thank you, sir. Thank you, ma'am, for this webinar.
Thank you. If you have any queries, we can give the answer.
No, sir, no query.
Thank you. Thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you.
If
Thank
you
you, sir.
all want to
Thank you,
give
sir.
any kind of, hello, my dear students, if you want to share your personal experience regarding COVID-19, you can share with us.
I think they have no
They
question
have already, they have already know everything.
or nothing.
Okay, so
So we can conclude that.
okay, okay, sir, okay, sir. Thank you all.
Thank you, ma'am.
Thank
Thank
you,
you,
ma'am.
Thank you,
ma'am.
ma'am.
Thank you, ma'am. Thank you, sir.
Thank you,
Thank you, ma'am. Thank you, sir.
thank you, thank you so much for joining us.